I'm Dr. Fundaro. I'm from Italy. I'm a general surgeon and a plastic surgeon, and usually I perform both surgical and non-surgical procedure, and mainly in the aesthetic field. So I perform a surgery, and I mean body surgery, breast augmentation, liposuction, and other types of surgery, and also facial aesthetic surgical procedure. But nowadays we have a high request of minimally invasive procedures, so often I perform also this type of procedures. I'm here in Kyiv to start a training program of some Ukrainian doctors that we build the trainer of the YVOIRE filler. And so we start this activity today, and probably we will continue in the future. And because we want to share our approach, the anatomical approach, with the doctor that lives in Ukraine. And so we start today with some specific technique in some specific area. In the future we will cover all the area of the face. I think that the dermal field has a very important development in the last year. A lot of new filler arrive on the market, but it's very important to be sure that the producer of this new filler is a good producer, because the safety of our patient is a very important aspect, and we have to check who produced this filler. And in this case, I'm presenting a filler produced by LG Chem. LG is a very important company in Korea, and they are able to produce both the raw material and the final HA fillers. And this is very important because they can control all the supply chain, and so we have a high safety, and we are sure that we are using a very safe product in our patient. The other aspect is that now we are starting to understand that it's important to know the physical characteristic of the filler, because knowing the physical characteristic of a filler, we can decide which specific filler we can use in each specific area to reach every specific final result. So we need to know the rheological characteristic of a filler, and based on this characteristic we can plan the treatment of our patients. If you want to understand the difference between a fillers and another fillers, it's very important to know the rheological characteristic. YVOIRE filler has the highest G prime, means the elastic modulus, means that it has a very high volumizing capability. And this is, I think this is the main difference between the other filler. So, as usually we need to increase the volume of the face of our patient to reduce the aging signs, we need a filler with a high G prime, because this filler warrants a very high volumizing capability, and this is one of the main characteristics. The other characteristic of YVOIRE filler is that the LG use a very long chain of hyaluronic acid, and this allows the reduction of BDDE, that is the cross-linking agent. And if we are able to reduce the BDDE, we reduce the inflammatory stimulation that fillers can give. And this is again a very important aspect, because if we reduce the post-inflammatory reaction after the injection, we reduce the discomfort of our patients. Concerning the YVOIRE portfolio, I prefer surely the Contour, because Contour is the volumizing filler. He has a very high G prime, and so using this filler I can restore the volume of the face with a quite limited amount of filler, and this is very important. Also because patients have to pay less, and this is an important aspect, but also because if you reduce the amount of HA filler that we have to use, we reduce also the side effect that we can have, and so we can offer a treatment with a very low rate of side effect, and patient can start immediately to have their normal lives. The characteristic of YVOIRE Contour is that it has very big particle inside of hyaluronic acid, and this can create some problem when you inject. And in this case, the algae solve this problem, adding little particle that fill the void between the bigger particle. This reduces the friction between the particles, and so you have a very easy injection. You improve a lot the injectability of the filler, and in this way you can use a very high G' filler, but you can inject it in a very easy way. You can define this filler as a hybrid filler because you have a very high G', means high elasticity, but thanks to the fact that the particle has a smooth surface, you have a low viscosity. And so you have both the characteristic of that usually you can find in the filler, means high G' and low viscosity. And so we combine the two main characteristics that you can find in the other filler on the market. Nowadays we have to restore the volume of the face, and mainly we have to restore the volume of the mid-face. So the main treatment is done at the level of this specific area using usually YVOIRE Contour because it is the volumizing filler, and I prefer to use cannula nowadays because it reduces the damage of the soft tissue that you can't create during the injection, and mainly because it reduces the risk of intravascular injection and reduce the bleeding, means that you have less bruising, and so you have a really minimally invasive procedure using this specific injection technique. I prefer to use YVOIRE Classic when I treat lips and I want a natural result. Of course, you can use this filler YVOIRE Classic when you have to treat fine lines and wrinkle with a limited depth. Volume could be used if you have to treat a wrinkle with a higher depth, and you can use also this filler if you want to treat the lips, but patient wants bigger lips. So if patient wants big lips, a volume is absolutely a good option. Today we start a training program here in Ukraine, and I think that Ukraine doctor will find very interesting this new filler because they can discover the characteristic and the result that they can give to their patient. We believe that the knowledge of anatomy is fundamental if you want to treat the aging process of the face, and so I'm sure that Ukrainian doctor will appreciate a lot the opportunity to have this type of training.